I will ask Dr. Hasegawa if we have 10 minutes for some questions.
Okay, yes, thank you very much, Professor Daniel Pinheiro. I'd like to start with the pathophysiology of cardiovascular effect by COVID-19. And Professor George Dan, you talk about excellent lecture about coagulopathy and arrhythmia in COVID-19. But just I'd like to ask you about the ethnic difference on the incidence of thrombogenicity. According to Japanese data, actually the frequency of thrombotic event is very low. There may be the ethnic difference. And do you think the low events of thrombogenic genicity is related to the low mortality in COVID-19? Do you have any comment?
Thank you, Koji. If I have understood your question, is let's say a discrepancy between what I have shown on the physiopathology of the coagulopathy in COVID and the low frequency of thrombotic diseases registered in several countries in COVID. Am I right?
Yes, in Asia, the incidence of a thrombotic event is very low.
It is very difficult for me to make a good appreciation for this. Probably there are at least 3 important factors to explain this thing. One is that it could be linked to the modality of looking for the thrombotic manifestations. If you are concentrated to look for such thrombotic, for example, doing routine CT with contrast media, we can obtain more than simple relying on the clinical basis. And for example, in my hospital, and not only in my hospital, in several hospitals in Bucharest, we are doing quite routinely the CT examination, and the number of the patients with pulmonary thromboembolism is quite important. This could be an explanation. The second, obviously, it could be also a phenotypic difference between the Asian population and the European population, and also linked to the interference between the COVID and the specific population phenotype in several countries. Finally, there are some amazing manifestation of the thromboembolic disease in COVID, because when we are talking about the thromboembolic disease, I'm less referring to the, for example, deep venous thrombosis or pulmonary embolism, because it is a general rule to have an anticoagulant prophylaxis for these patients. But I'm especially referring to microthromboembolic complication. So the microembolism in microcirculation, including lung or heart. Unfortunately, if you are looking in the literature, the case reports are only few cases from the pathologic examination, but there is a general denominator that microthrombosis is present in such patients, which could be important and can complicate the picture. It seems that the therapeutic anticoagulation, in order to prevent such kind of microvascular thrombosis, seems to not be very efficient. So the mechanism linked to inflammation could be a little different, and we are looking for the proper way in order to influence this microvascular thrombosis.
Koji, I have a question for you.
Okay, thank you.
My question is about the managing clinical practice of depression in people with COVID and without COVID during the pandemic.
in
Your
case
mic.
of during the COVID-19 pandemic, the lockdown, the staying at home will be the main cause of psychological stress. So I usually advise the patient, and let's go out. If the people are few, let's go out to temple and shrine. Almost no people. Even though the government push not to go outside, I will advise patient to go out. And also, well, in case of COVID-19, we cannot meet people. That is also another threat. But basically, the way to relieve stress maybe is similar. And as described by Dr. Yeo T. Joe, exercise is very important for de-stress. And also that the, in case of Japan, laughter yoga is very popular, and just laughing is good for the healthy. So I think the mental health is important. Positive thinking important in any cases during the COVID-19 and or before and after the COVID-19. Thank you very much.
May I
Thank you.
intervene?
Sorry, go ahead, please.
I should confess that I want to link my question to your question, Professor Pinheiro. I should confess that I was impressed by all three conferences of my colleague Koji, TG, and Mungo from different point of view. And I want to ask you as a personal request for advice. In Romania, it was a very special situation during COVID. The patients, especially active patients, and in some period, even asymptomatic patients, were confined to the hospitals. Now it's a little high degree of freedom. So if not symptomatic, they are confined home. But also for the patients with symptomatic disease, severe or not, especially moderate and not severe, there is an important, tremendous psychological impact. I should confess that my problem during the COVID period since March to February 2021, when I dealt only with COVID patients, my main problem was not the cardiology problem because this is routine, but was a psychological problem. So I know when I was in Japan, Koji taught me about the philosophy of Japan of laughing. It is something very special, not applicable in Europe, but which could be the solution in order to surpass this problem of confinement of the patients and the high degree of depression. I should confess that we had to be very careful with several patients normally in normal life, very close to suicide or cognitive impairment during this period. So what do you advise?
I have a connect question to Dr. Joe, because I'm very impressed by the 81 adolescent people without any exercise. Which is your position about the school and the lockdown and to have schools or not to have school? You know, here in Argentina, we have 1 year without school, and this could be important for especially for young people. What's your opinion, Dr. Joe?
Okay, so thank you for your question, Professor Pinheiro. In Singapore, I draw my experience from how Singapore has dealt with the COVID pandemic. So we are very fortunate in that we are a very small country, just about 40 kilometers wide, you know, far from how big Mongolia is. So everybody is living in a very dense area, but at the same time, governance is easier. So our Singapore government has dealt with COVID in a very strict manner. So things like wearing of masks is actually made a law. And if you don't wear a mask, you can get fined. If you are supposed to be quarantined and you leave the quarantine, you can even go to jail. So with that, you know, we made it very, very strict. And of course, there are also tracking devices, if you want to put it that way. Basically, they are little tokens that will be able, every Singapore citizen is given a small device that you will have to beep when you enter a shopping mall or a restaurant or any place that you go, which is public place, you have to beep that device so that when a COVID case is detected, anyone who is in close contact during that time is straight away contacted, and they can be quarantined very quickly. Of course, there are people who say that it is an invasion of privacy, but so far, a lot of people have been using it. And if you don't use it, you can't go to the places anyway. So going back to the school, what we did was in Singapore was there were periods of time when school was completely closed. Following that, because the incidence of COVID and the severity of COVID in younger children is actually much lesser. So they often are asymptomatic, or they do not even manifest any symptoms or very minimal symptoms. So we stagger their class times. So like, for example, the grades 1, 3, and 5 will go to school in the morning. Grades 2, 4, and 6 will go to school in the afternoon. And as part of our lockdown measures, we keep families together in groups of 5, or rather, families cannot go out more than a group of 5. For now, we've increased it to 8, as I mentioned in the talk. So there is no intermingling in our initial period of lockdown. So children cannot go to all their grandparents and potentially spread illnesses. So that is how we actually dealt with the situation in Singapore, and thankfully, very early on, we managed to control our cases, and we can slowly relax those measures. I think it is a matter of being firm early and controlling the disease in a rather small land area. Oh, so Professor Dan asked, what kind of device am I referring to? So it is something like a Bluetooth device that every Singapore citizen carries. So it is supposed to only be used when tracking COVID cases and nothing else. Of course, now our government is said that, you know, in case of very serious crimes like murder, they might use it. So some people are very upset in the country. But I can put a link later in the chat to show you what the device looks like. From the discussion earlier, I would also like to bring up a point about depression, actually, because we have talked a lot about depression and suicides in our patients with COVID, but I feel that we must be very mindful of the same symptoms in our colleagues and our peers, because that is as important as patients experiencing COVID-19. Because especially in areas where the healthcare providers sees that, you know, the resources are being overwhelmed, they take in long shifts, they cannot see their families, it is a very big burden to them. And it is even worse if they themselves get COVID. So I think we have to be mindful of looking out for our own peers as well.
Thank you so much for bringing this point. It's very important. The physicians and all health workers in this pandemic. My last question is for Dr. Mongo, and my question is about the cultural change with telemedicine. I want to know if you feel that every patients are very glad with this kind of medicine, and if there are cultural change, different positions, especially with the rural population, that is difficult to reach. And but I don't know if there are, they accept this kind of medicine.
Currently, we are using our telemedicine system physician to physician level, and we are just integrated to the system the section patient physician platform, which is under testing. But from those who had consultation online, most of them was satisfied with the consultation. But we have to keep in mind that those were all the diagnosed patient with the chronic disease. Most of them was with the arithmological disorders. So they were, for them, it was more time saving and not exposing themselves for the crowded place and the risk of infections. That's why they expressed as they satisfied with the consultation. We also tried to expend more time for the online consultation than the average in the outpatient department. So that's why patients' files were carefully examined by doctors and discussed in close contact. In the more spending more time was also might be the reason that they were satisfied. For rural patients, we did not experiment this online consultation yet. For rural settings, we are only communicating with the rural doctors to support them. This is the situation.
Thank you. Thank you so much. If Dr. Hasegawa allow me,
yes.
I have a last question for each of you. I want a very short opinion of each of you about vaccines and vaccination. Dr. Dan, please. What's your opinion about vaccines and vaccination?
Thank you so much, Professor Pinheiro. Usually we have a lot of discussion in this regard in Romania, and everyone wants to be prudent and to tell, I don't want to influence. On the contrary, I want to transmit my very firm opinion. I am strongly for the vaccination. I don't know exactly, and nobody knows the long-term effects of the vaccination. But we need to be assured that the vaccination has passed all the steps of the clinical research, only of the higher speed. So I'm confident with what was published. Myself, like you, probably, I am vaccinated. There are differences between vaccines, but only during the time we'll see which are exactly the differences in time. And in my opinion, this vaccination brings us a double advantage. First, it's a personal one, of course, and I'm not only referring to the antibodies, but also to the cellular immunity, which is important, it's difficult to visualize. And second, if we succeed to have a critical mass of people vaccinated, we have a theoretical chance to decrease the virus load and to eradicate, which is, I'm not very convinced, but theoretically could do it.
What's your opinion, Dr. Hasegawa?
Yes, thank you very much. Yes, thank you very much. I'm not a specialist of the infectious disease, but I believe that the vaccination is not only reduce the onset and the worsening of COVID-19, but also probably will inhibit the transmission. So I believe by vaccination, the temporary COVID-19 will subside. But I don't think we can completely disappear the COVID-19, it's very difficult. The virus will change it and also mutate it. So maybe in future, we need to generate a new vaccination. We need to inject the vaccination every year. Maybe we need to keep contact with COVID-19. Maybe we need to become friends with COVID-19. Thank you very much.
Thank you, Koji. And Dr. Joe, what's your opinion about vaccines and vaccination?
Yeah, so I think Professor Dan has elaborated in a very elegant way. I have personally also received both vaccine doses. The second dose was just earlier today. So I am for the vaccine. Personally, my perspective towards this is more like how can we convince our patients? And I think a lot of hesitation is because of the fact that it is new. But I think, we should try and use the flu vaccine as a reference point, because a lot of our heart patients, they do get regular flu vaccines and they may not even think twice about it. They take it as a routine. They say, oh, doctor, have you ordered my annual vaccination? I'm looking forward to it. So we have to try and use that as a reference point to have a mindset shift for our patients. Because these are the vulnerable population and they are the ones that deserve and need to be protected the most. So as what Prof. Dan has said, that once we reach a critical mass, we can potentially have looked forward towards a new normal. And I think the world is on its way. It's just how long it will take.
And Dr. Mongo, your opinion, please.
Yes, I'm completely agree with Professor Dan and with all of people speak about vaccine. I definitely go for vaccine. And the important thing is we really have to encourage our patients community to accept the vaccine as it is. And the way we might also take an example that some 500 years ago, there was a vaccines which benefited up to today. So it is that time it was not that much proved the vaccine, the safety of the vaccine, but the whole population benefited from it. So we really have to encourage and promote the vaccination, and that's the only way how to get out from this pandemic situation. And for me, it doesn't matter which vaccine it is, but all of them is past the safety. So no matter which one, but definitely the more than 60% of the population has to be vaccinated. Thank you.
I want to add that the World Health Federation is preparing a position paper about vaccination in COVID. We are going to launch it in the next weeks. And the most important things for us is that vaccination is a reality. Vaccination has to be massive, has to be equal for people. The priorities with all people, people with comorbidities and physicians and health workers. So we support very much vaccination for all as a right, not just an economic issue, but a human right for all of us in this world. So I want to invite you to contact World Health Federation and to read this paper, and please to disseminate this document. I think will support vaccinations very hard. I'm going to finish now just saying thank you so much. You are big leaders in the world of cardiology, and I think the crisis make us show what's the leadership is to be quiet and to think in our patients, in our colleagues, and in the world. So thank you so much for joining us. I want to thank Dr. Hasegawa to host out us, and I will ask him to close the webinar. Thank you so much. My pleasure.
Thank you.
Thank you very much. Okay, just I will say thank you very much for all of the speaker chairs and all of the audience. Thank you very much.
Thank you.